Okay, so now that we've gone over what happens on the outer side of the body and how we treat it, one thing I want to show you is how degenerative disc or nerve compression can happen from your spine from a biomechanical nature. Again, if it happens from a biomechanical nature, it's not going to get fixed with just medication masking the symptoms. We're going to really have to get in there, and obviously we're hoping and we're committed to being your first stop before surgery. All right, so what we're looking at here is a spine that we have going on, and this person right here, there we go. We're going to just sort of tilt the camera just a tad bit. And what you're looking at is the spine here and how the lower part of the body and the muscles like the psoas and the iliacus interact with some of the nerves that are coming out. And what happens over time through wear or tear and damage to the spine itself, you actually get, there we go, let's angle that, this difficulty where all of a sudden as time wears on and you age, that the actual vertebrae start to compress because the discs are compressing. And so that aberrant stress pattern ends up compressing on the nerves. You see as they turn from yellow to red, right? They're irritated. They become inflamed from a biomechanical nature, not a virus, not a germ. And as that happens, it affects the actual function downstream. And as you can see, as normal wear and tear, the bones start to erode and start to change and become arthritic. That compression can lead to any one of these nerves being dysfunctional, and then the muscles or the organs that they reach to also. Then finally, as you go down the spine, we end up getting this problem with that the nerve or whatever's getting compressed down the spine end up also having problems. So we want to see that, and that's what we end up relieving when we put you on a decompression table and start to also do tissue work or laser, is using the decompression table to help open up these parts of the spine again so we can take the pressure off of it and get fluid back in. Now, we are not going to reverse the bone damage. That's why you want to get in as soon as you can before there's too much bony damage. I mean, unless you're going to go to surgery, which we don't do, this kind of damage can be long lasting and it'll be for the rest of life. So stop it as soon as possible. Now we have a neck and something similar. Text neck, looking down all the time, being on the computer, you see the spinal cords going down as a big yellow line down, and then the nerve roots, as you lose posture, as the discs degenerate, they can compress right on those nerves. And now you see how all of these end up getting pinched. And for those of you with those tight necks that stay tight all the time, the symptoms that can come from that range all the way from, when you're looking at this, if this vertebrae is compressed at the C3, it's going to affect all the way to the top of the shoulders, part of the back of the arms. That's going to be affected down the hands, in the spine, down to the legs, or down all the way to the feet. So whether it's from diabetic neuropathy that's concurrent with your compressed discs, or it's just the compressed discs from injury over time, you can end up seeing that, hey, we're going to have problems here that aren't going to be solved by a medicine or an injection. So that's why what we're here to do is be able to increase the longevity of your body from a physical property, and using decompression techniques, using tissue techniques, using laser techniques. We're really trying to combine the best of all worlds, so you're getting treated just like you're a world-class athlete or some millionaire with billions in the bank, but we're making it affordable for you. So this is the end of the video. Please go ahead and get in touch with us, and we definitely answers questions over the phone. Just tell my assistant you'd like to set up a phone conversation with the doctor. Thank you and have a great day.